Officials are warning that since the Omicron variant is so contagious, the best defense is to have a booster shot. We want to take a look at U.S. vaccinations. According to Johns Hopkins, 203 million Americans are fully vaccinated. Now, as we've seen, you can be vaccinated and still contract COVID. So joining us right now, Dr. Kristin Englund, an infectious disease specialist at the Cleveland Clinic in Ohio. Good to see you as always. You know, Dr. Fauci initially said there was promising data surrounding Omicron. We did not see, and we still haven't seen, the severity of symptoms with this latest strain as we have with strains like the Delta variant. Now, Dr. Fauci this weekend is saying that there will most certainly be this spike in hospitalizations and deaths this winter. What prompted his change in messaging, do you think?
Well, even though Omicron may not be as deadly as Delta, we're still seeing a lot of Delta cases out there right now. But the overall numbers of people infected with Omicron is going to be astounding. So we're going to see a huge number of people. So even if only a small percentage of those are ill enough to get hospitalized or die, those numbers are still going to be very large.
But it is such a strong statement that Dr. Fauci is making. And words like this is going to be raging at hospitals. Is the concern that medical staff coming down with Omicron could be out of work, which would further impact the availability of getting medical care? What is the biggest concern for the medical community in Omicron?
Oh, I absolutely think we're going to be concerned about being able to keep staffing up in all of our hospitals. So first of all, the hospitals are going to be completely full if they're not already completely full. And then add to that the fact that we have our own staff who are going to be getting ill. And it's not just the medical staff, it's the environmental services workers, it's those trying to get food to our inpatients. So there's a lot of need for people in all of the hospitals. And as more and more get sick, it's going to get difficult.
Okay, so I still feel that I think for a lot of people at home, there are differences of understanding here, because describe some of the symptoms. They're totally different than any other strain of coronavirus we've seen. What do we know about Omicron symptoms?
So I think for the Omicron symptoms, we're seeing kind of a variety of things. Some people just have sniffles, especially if they've been vaccinated. They might have sniffles, they might have sore throat, cold types of symptoms. We are still seeing people losing their sense of smell and taste. Some people might get more of the diarrheal type symptoms. So we're seeing a wide variety of them across with Omicron.
What's the best precaution, do you think, for people who are traveling or maybe perhaps people getting together for holiday gatherings, even if they're just driving to see their family, but they have differences of opinion about wearing masks, social distancing, and being vaccinated?
So I think what you have to understand are the people that are coming to gather together, and you have to understand the risks, and every person needs to know what their kind of risk limit is. So if you're somebody who is older and has a lot of medical illnesses, then you're going to have to put your foot down about the people who are coming to visit you and make sure that they're vaccinated and kind of set some ground rules about wearing masks indoors. For those who are fully vaccinated and boosted and otherwise healthy, you're going to be able to kind of lighten up those rules a little bit and be able to not wear masks around if it's a small gathering. But I think it's always best to set the ground rules up front so that people know what to expect and that you don't get any holiday surprises.
Well, is there still time to get a booster shot if you haven't yet before Christmas?
So there's still time to get one. Usually our boosters are not going to be as effective until about 2 weeks after the booster shot, but it's certainly worth getting it and trying to at least boost your immune status a little bit. I just had my son vaccinated last week, got his booster, and he's coming home tomorrow.
And real quickly, hot spots in the country, not everybody is seeing a rash of cases. So what communities are the most right now at risk?
So we're certainly seeing the East Coast and the Midwest are clearly very involved with both Delta and Omicron right now. We know that Omicron is doubling every 2 to 3 days. So if it's not reported in your community now, it will be very soon.
All right, Dr. Englund, thank you so much for being with us. Still ahead.